A very good afternoon to all. Today, I welcome you all for the 63rd lecture arranged by Academy of Rog Nidan. For the month of September, we have coordinated Professor Anukul Chandrakar sir. And for today's 63rd lecture, we have uh, a young and dynamic speaker today, Dr. Advait Menon. So I request respected Anukul Chandrakar sir to start the proceedings. Thank you.
Thank you, Dr. Ganeshi.
Yes.
All the participants present today. Today's speaker, Dr. Advait Menon. It is my pleasure to introduce Dr. Advait Menon, today's speaker. He did his undergraduate from Gomantak Ayurved Mahavidyalaya, Goa, and did his post-graduation from College of Ayurveda and Research Center, Kakurdi. He is currently working as assistant professor at Bharati Vidyapeeth since last 2 years, and he is having clinical experience of more than 6 years. He was instrumental to work as a medical content creator for National Exit Test, Foreign Medical Graduate Examination, United States Medical Licensing Examination Aspirants at Advait Education World. He is also acted as a ad hoc medical writer for clinical trials conducted by private research firms. And he has 2 publications to his credit, which is published in the reputed journals. And his area of interest in Ayurvedic practice and clinical research. So it is a very brief introduction of today's speaker. So with these words, I now hand over the platform to Dr. Ganeshi for further proceedings. Thank you very much. I'm sorry, I have to leave to travel to Odisha. So my flight is at 5 p.m. So I'm leaving. I'm sorry I could not attend. Thank you very much.
Okay, sir. No issues, sir. I welcome Dr. Atul Vashne, sir, then Subhash Saleh, sir, Dailekar, sir, all the respected members who have joined for today's lecture. With this, I request today's speaker, Dr. Advait Menon, sir, to start his lecture.
Thank you very much, sir. And I also thank Kar sir for that introduction. And today's topic, as sir has said, I am very much, in fact, honored to present today's topic in this beautiful series that Academy of Rog Nidan has started to conduct. And itself, it's very informative, and it's a privilege that I can present here. So the topic for today's presentation is Srotas Paikshan, and it is one of the clinical tool that we can employ when we are doing examination of the patient. To start with this, today we will be focusing, because it is quite a huge topic, and today we will be focusing primarily on the Srotasas that have been enumerated by Charak Samveda. And the choice of this topic was because we know that in modern medicine there is systemic examinations that are available for the students to go through one-on-one system and arrive at a particular diagnosis. But in cases of Ayurveda, we know that each and every case paper in every college, Ayurvedic college, does contains this Srotas Paikshan. So these Srotases are nothing but they are systems present in our body which are essential for the normal functioning of the body. And hence, if examined in a very systematic view or in a very systematic process, I think so they are very crucial. They are one of the tools that can be used to diagnose the particular patient that we will be examining. So this is about the today's topic, that what we will be focusing on. The focus will be on Srotas, and it will be in a systematic manner so as to make sure that we arrive at we arrive at a proper diagnosis. Uh, we will, since it is a very huge topic, I will be just focusing on how to approach the Srotasas in a way that will help us to aid in the diagnosis of the disease. At the end of the lecture, what is expected is that one will understand Ayurvedic clinical approach to Srotas Parikshan. And secondly, understanding the Ayurvedic clinical anatomy and physiology for respective Srotas. It is not just the Hetu or the Lakshan of the Srotas that we are going to see with respect to examination, rather the clinical anatomy and physiology that is essential for that particular Srotas is what will also be the matter of talk for today's lecture. Intended audience is the second year UG that has just passed with the knowledge of anatomy and physiology, and now it is, as being a Rognidan lecturer, it is our duty to teach them how to use this knowledge in a way that can help them diagnose the patient in an Ayurvedic manner. So the entire gist of this particular lecture is going to be to make the student diagnose in an Ayurvedic way as to what condition is there in the particular patient. And secondary audience obviously is our postgraduates, and the uh, the presentation is designed in such a manner that even Ayurvedic practitioners can use this particular this thing in their day-to-day clinic so as to make a proper diagnosis. The references for the whole topic is Charak Viman 5 and Charak Sutra 28. So as we know, there are 13 types of Srotasas that have been enumerated by Charak, which we will be going through one by one. Now, what is the importance of this Srotas in the body? So, Vriddhi and Shaya, why we need to do the Parikshan of Srotas? This is what is necessary to know, first of all. Because the first point is that the Vriddhi and Shaya of the Dhatu takes place by the patency of the Srotas. So, as described in Charak Vimanstan, all bhavas which are there, they undergo transformation in their respective Srotasas. Second is the Parinamam Apatyamananam Dhatuna. So from Rasa to Rakta, Rakta to Mamsa, Mamsa to Med, ये जो धातुओं की परंपरा है. In that sense, all the transformation from one dhatu to the next dhatu, Parinamam Apatyamananam Dhatunam. This is the second clinical implication of Srotasas. So from one particular, from Rasa dhatu, the Parinaman to Rakta Dhatu is done in their respective Srotasas. Third is, if Srotas are normal, if Srotas are Prakruti Bhut, then the Vikar won't take place. That is, the rogue won't manifest if Srotasas are in their normal condition. If they are not patent, then obviously it is going to lead into disease condition. This is a very important shlok that Charak has given, that while explaining Dhatu Pradosha Vikar, Charak says that if doshas do dushtis of the respective Dhatu or Srotas, for example, Rasa to Shukra, then they will produce specific symptoms. These symptoms are specific to that respective Srotas. And hence, the Srotas Dushti Lakshanas are going to be an important tool to assess what Srotas Dushti has been taken place. But not just the Srotas Dushti Lakshanas are going to help us to diagnose this particular condition. Rather, the anatomy and physiology of the respective Srotas needs to be taken into consideration when we are arriving at a complete diagnosis. For example, Aruchi will be present when doshas will create dushti of Rasavaha Srotas. So if Aruchi is there, it is certain that Rasavaha Srotas is dushta. Hence, Srotas Parikshan is an important template to do Dushya Pariksha. So it is one among the many clinical tools that we employ when we are doing Rupna Parikshan, there might be for Roga Pariksha, there is the Nidan Panchak. And this can be one template that can be used to do Dushya Pariksha, basically, which Dushya is involved in the particular disease. What is Parinamam Apatyamananam Dhatuna? Whatever we eat, its parinaman takes place into a human body. So this parinaman which is there from the human body, that is made up of rasa to shukra, the doshas, the malas, etc. This parinaman, what is there, that is taking place in their respective srotasas, and hence even if we eat a goat, it transforms into a human being. And this parinaman, for this parinaman to take place, the srotas being in a normal condition is very, very essential. So this is nothing but the way ahar ras is formed from the anna that we eat. By the action of Jatharagni, the ahar ras is formed, and the ahar ras is then circulated. This is quite in short I have given to their by the vayu, it is being circulated all over the body, and by the different nyayas, the respective dhatus will take into their portion which is there. Now, a question arises as to how come asti vaha srotas, how is there asti vaha srotas, because Shushruta has also explained srotas concept, and he has obviously omitted asti vaha. The concept of Charak, when he is saying asti vaha srotas, it is obvious that asti jaisa ghana dhatu kaise uska vahan ho raha hoga. So it is not, let us make this clear, everybody knows this, but let us recapitulate the same thing, that whatever is flowing in the srotas is the margaga dhatu. And margaga dhatu has two components, that is the poshya component and the poshak component. The poshya component will go to the stula dhatu. So for example, in the rasavaha srotas, the poshya will go to rasa dhatu, and the poshak, that will go to the next dhatu, that is the rakta. So rasa will send its poshakansh to the rakta, and like that the parampara goes down to the deeper dhatu. So whatever is flowing in the srotas, it is the margaga dhatu that is there, which contains the poshakansh to that respective dhatu. And hence astiva srotas is not something very not possible or non clinical sort of. So Srota Samanya Hetus which are there, it includes Ahar and Vihar, which are similar to the Gunas of Doshas, and which create Kha Vaikunya in that respective Srotasas, are the Samanya Hetus for Srotas Dushti to take place. So any Ahar Vihar which will do Dosha Prakop and will create Vigunata of Dhatu, these are the Samanya Hetus that Acharyas have given. What is the Samanya Dushti Lakshanas? Ati Pravrutti Sangova Siranam Granthayor Apiva Vimarga Gavanam Chapi Srotasam Dushti Lakshana. So Ati Pravrutti we can interpret as hyperactivity of the system. Sangha, which is hypoactivity of the system. Sira Granthi and Vimarga Gavan. These four ways we can interpret the Samanya Dushti Lakshanas of the Srotas. Now, what was the need to explain this? Because Charak himself has said that Srotomayo Ayam Purusha, the entire human being is made up of Srotasas, and hence, to if need arises, apart from these 13 Srotasas that have been explained by Charak, there are various scattered references of Manovaha Srotas, Ashruvaha Srotas, etc. So overall, in general, Charak has said these are the 13 primary Srotasas, and then there are n number of Srotasas that are there. Whatever Samanya Hetu and Samanya Dushti Lakshanas are there, it is to interpret those Srotasas which are not being enumerated in a detail by Charak or the Acharyas. Next, we will start with Pranavaha Srotas, and as we have said, the clinical anatomy and physiology is going to play an important role when we say Srotasas. So the very first important thing is Pranavayu. in Pranava Srotas, which is responsible for Shabdocharan and Uchvas. When we are examining Pranava Srotas, we will make sure that we examine these following organs, for example, mouth, nose, kantha, ura, nabhi, because it is the sthana of pran, fufusa, hridaya, and obviously Udan Vayu. So pran and Udan Vayu in relation, these two Vayus in their normalcy, they are responsible for the normal functioning of the Srotasas. And hence, when we are examining the patient or when we are taking hetus, we should be prudent enough to take hetus in relation to these two Vayus, that is Pran and Udan specifically. Now, if we come to the utpatti of the organ that is there, that is the fufus, it is made up of Rakta Fena Prabaha Fufusascha. So why this is important? So any congenital defect in the child involving the pranavaha srotas or manifesting as dushti of pranavaha srotas, we should trace it back to their respective, we should trace it back to their respective parents as to how is their status of their rakta dhatu. So if their rakta dhatu status is hampered, then it is possible that the baby has, in terms of congenital defects, the baby has got their, because the Khavai Gudnya was there, and during Shukrartha Sayog, the Dushta Rakta was there, and hence the Utpatti of the progeny which is there, it is having defect in their Pranava Srutas. Like this is one important reference that I thought that would be important. Just like we take birth weight of the baby, Rodan at birth will initiate the Vayu in the fufus. This is one more thing that we should take into consideration, especially if an Ayurvedic Vaidya is, taking a case as to how much time did it take, or was there proper Rodan at birth or not. Similarly, Ura is called Ura where the Pranava Srotas, the organs are residing. Ura is a very important organ of Shleshma, or very important site of Shleshma. And also, it is also said to be site of Jiva Rakta. Jiva Rakta. So these are the two important references, and hence the Shleshma is going to affect the working of the Pranava Srotas in a it is going to be very essential for the working of Pranava Srotas. And similarly, whenever there is Dushti of Pranava Srotas, we should assess the role of Shleshma. So overall, in a nutshell, Pranavayu, then Udan Vayu, for congenital this thing, we should take into consideration the Rakta Fena Prabhava, and hence the Rakta Dhatu of the parents of the respective progeny. At the birth, was the initiation of the Vayu proper specifically, and then the status of Shleshma when we are considering overall Pranavaha Srutas clinically in terms of anatomy and physiology. These are the factors that we will see. Now, apart from just clinical anatomy and physiology, it is important to understand the Mulastan of the Srotas, and its parikshan is very important. So, Hridaya Moolam Mahasrotascha, these are the two Mulastans that have been uh, given by the acharyas, and Hriday we will be seeing during the Rasava Srotas. But Mahasrotas is an important Mulastan, and if Mahasrotas, the Mulastan itself, is having some problems, then it is certainly going to manifest in their respective Srotasas. So Mahasrotas is the patency of Mahasrotas is going to be essential, especially when Pranava Srotas is involved. What are the hetus? Hetus of Pranava Dushti will be primarily, you can say, Vata Vruddhi, or those who are affecting the functions of Vata. For example, Kshaya, wasting of muscles, wasting of the body, suppression of urges, Rukshata, physical exercise, especially during hunger, if the patient undergoes physical exercise, rigorous physical exercise, especially when he is hungry. And obviously, the Srotasam Annesha Darune, the patency of other Srotasas in the body is an important factor to for any disease to manifest in the Pranavah Srotas. So what are the Dushti Lakshanas? In the Dushti Lakshanas, we can say there is all Dushti Lakshanas are specific to the expression of Shwas or to the expression of how the patient is breathing. So atisrushtam, atibaddam, kupitam, alpalpam, bhikshtam va sa shabda shulam uchvasantam. So in terms of Shwas, when it comes to Pranava Srutas, any condition that is eventually manifesting as problem with breathing, or in that case we can say dyspnea, is going to indicate towards the dushti of Pranava Srutas. And when dyspnea is there, or when the breathing of the patient is hampered, we are going to think about first the assessment of the Mulastan of the patient, and second the clinical aspects, clinical and physiological aspects of Pranava Srotas, that is Pranavayu, Udan Vayu, then the patency of the Shleshma, etc. So the expression of Pranava Srotas Dushti Lakshan is obviously going to be Shwas, and hence if we see dyspnea, if we see in a normal way, then dyspnea can be found in many systemic conditions. Hence, in the Hetus, Acharyas have very smartly given that Srotasam Anneshya Darunai. So, any Darun Dushti of any other Srotas is going to manifest into Pranava Srotas Dushti. So, what are the causes that we generally find today? So, in cases of Pranava Srotas Dushti, like the expression of dyspnea, we can see that there are many causes, like there is cardiac cause, there is pulmonary cause, there is hematological cause, there is metabolic cause, there is psychiatric cause, and obviously there is obesity, etc., which are giving various shades of Srotasam Anneshya Darunaihi. So Anya Srotas, when it is excessively vitiated, it is eventually going to affect the Pranava Srotas, and hence the examination, when there is dyspnea in the patient, the examination of all these other Srotasas is also going to be very, very important, because Srotasam Anneshya Darunai is one of the important factors which is an etiological factor for Pranava Srotas Dushti. Pariksha Bhav will be Nasa, Kantha, Shwasan, and obviously Shrivan. So Shrivan will give us a very important insight as to whether the kapha is involved over there, or whether Jiva Raktashay is Jiva Rakta is involved in that case. So Shrivan will give us very important insights into what is the status while examining Pranava Srotas. Next is Udakvaha Srotas, the clinical anatomy and physiology of Udakvaha Srotas, especially in Charak Sharit 7. Charak has very beautifully explained the overall what is basically Udak. When we say Udak, it is not just the water content of the body that we think of, but rather it is Udak is that entity which does Purisham Anubantati. अतियोगेन तथा मूत्रम रुधिरम अन्यस्य शरीर धातु यत्तु शरीरचरम बाह्यत्वक बिभर्ति, it does bibaran of the bahyatwak. It is responsible for the overall the turgor of the twacha. Then the same udak is responsible for lasika, that flows through the vrana, and similarly, if there is anubandha of ushma from the lomakup, sweda pravartan which takes place, that is also responsible, or that is also very much attached to the overall status of udak in the body. So udak which is there, it is not just the hydrating factor, but it is going to provide various, it is going to provide a dravata to the rudira. It is going to provide the normal physiological form to this, to the rudira, to the mutra. It is going to affect the purish. It is going to affect the swed. So we can see that clinically or physiologically, udak it manifests into various forms all over the body, and hence all these forms are going to be important when we are going to assess the Udak Vaha Srotas. How the Udak Vaha Srotas is there, if you want to assess in terms of overall examination, all these factors are going to be important. So Udak, apart from this, the kapha status is very important in to know, especially in Udak Vaha Srotas. The Udak kapha is the one which is going to give all its gunas to that. The role of Agni and Vayu are virodhi to Udak. And hence in cases of dehydration, starvation, or heat stroke, we can see we exactly dushti lakshanas are seen in the particular patient. So Agni and Vayu, these two factors are going to play an important role when it comes to Udak Vaha Srotas. Udakam kledayati, and hence if this particular function is to be considered, then clinically the how is the mutra and how is the sweda, this is going to be very important. So mutra parikshan or sweda parikshan is not just going to be essential when it comes to mutra vaha srotas or sweda vaha srotas. Rather, it is going to give idea about how the udak overall nature of the udak is there. Next, mutra utpatti, or in that sense, the total utpatti of mutra is there in Pakwashay. And we know that especially in Udar Vyadhi, Rudva Sweda Ambu Vahini, matlab the Ambu Vahini avarod is there. And the best chikitsa for Udar is said to be Virechan. And hence the status of the Pakwashay, where everything, if you want to release the pressure of the Udakva Srotas, especially in cases of Sangha Samprapti, then Pakwashay Parinaman, which is there of and Pakwashay Vibhajan of the Mala that takes place, that is also going to play an important role when it comes to Udakvaha Srotas. So Udakvaha Srotas not just is going to be the presence of water content in the body, but clinically it is very important to know the status of mutra, the status of sweda, when it comes to vrana, the status of lasika, and these all things are going to indicate towards how is the udakvaha srotas in the body. So Atyambupan and ajalpan causes armor, and it hampers digestion of the food. This is what Shushrut has said in Swastha Samuchay Adhyay. And currently this hetu is very important because in detox के नाम से लोग अत्यंबुपान वगैरह very recurrently they do all these things, and hence आम हम आगे देखेंगे in the hetus. Aam is also an important hetu for udak vaha srotas dushti. The status of amashay or the status of kapha that we have already seen is very important because in terms of overall quantity of ahar, the drava dhatu should be kept some amount of the overall capacity of stomach should be kept for the drava dhatu. And ऐसे हमें बहुत बार मिलता है कि while eating people don't drink water or they drink excess amount of water while eating. All these things are going to affect the functioning of the udakvaha srotas, and in such cases we can employ the status of mutra to the status of swed in such patients to assess how the udakvaha srotas are functioning or not. What is the mulastan of udakvaha srotas? It is the talu and kuloma. Talu and kuloma are the mulastan. Kulom के ऊपर बहुत there is a lot of different opinion as to what is kulom, but clinically if we try to assess, then I think so the oropharynx or the trachea is the best definition of kulom, because if you want to assess the dushti lakshanas of the udakvaha srotas, we will see that there is dryness of tongue, palate, lips, throat, and phloem. These are nothing but increasing order of severity of dryness or trushna that takes place. So in in Desh like Pune or in Desh like Goa, you won't find Klomashosh. But certainly, I think so, if we go to a more jungle Desh, where like for example Rajasthan and all, there we might be able to assess this particular lakshan as in Klomashosh. Jivva, Talu, Oshtak, Kantha, these shosh, when it comes to Dushti of Udakva Srotas, can be very much appreciated even in Sadharan and Anu Desha. But if you want to see Kloma Shosh, then that means the dryness in the trachea or the oropharynx. Maybe we'll have to go to a more jungle Desh to see that. The Dushti Hetu of with respect to Udakva Srotas is very easy, as in as we have discussed earlier, Agni and Vayu are viruddha to the functioning of Udakva, normal functioning of Udakva Srotas, and hence Oshnyat, Amat, Bhayat, Panat, Ati Shushkanna Sevanat, Ambuvahini Dushyanti, Trushnayascha Ati Pidanat. So Oshnya, all hetus that are increasing the Agni content in the body. Am, which is there, जैसे कि आमस तृष्णा वगैरह आया है. So am is an important factor in the Srotas Dushti. Bhaya and excessive drinking of alcohol. All these things are going to affect the normal working of Udakva Srotas, and it is going to manifest in this sense as in dryness of tongue, palate, lips, throat, and phloem. This is just purely clinical way to diagnose the Dushti of Udakva Srotas. And if we want to further go ahead and be a little bit more subtle, then we will assess the patency of Swed, we will assess the patency of Rakta, we will assess the patency of Mutra in that, and we will see whether Mutra Vaha Srotas Dushti Hetus are seen, or whether there is Sweda Vaha Srotas, whether there is Udak Vaha Srotas Dushti. So if Udak Vaha Srotas Dushti के जो हेतु है वो predominantly मिल रहे हैं, and then there is some some abnormalcy with Sweda Pravartan, with Mutra Pravartan, then we will primarily focus over treating or assessing the Udakvaha Srotas of the individual. Pariksha Bhav overall will be Oshta, look for the dryness of Oshta. This is very much evident in Udar Vyadhi, we can say. We can see in Udar Vyadhi that even in the Lakshanas, there is Oshta Shosh has been explained. Jiva Talu Ploma, look for Shosh. Check Trishna, how frequently he's, how frequently the patient is drinking water. One differential diagnosis for Ati Trishna will be Pitta Prakriti, because it is his swabhav. Varamvar Pipasa will be the swabhav of Pitta Prakriti. Check the status of Twacha, and in Twacha, we will see the status of hydration. So any signs of dehydration, especially in Udakvaha Srotas, we will see that. The differential diagnosis will be assessing Twacha Dushti because of Twacha Dosh or Twacha Rog because of Rasa Dushti in such cases. Then Sweda Pravartan, so DD of Udakvaha Srotas along with Swedavaha Srotas and Medavaha Srotas will be done to check whether the Sweda Dushti or Sweda Pravartan it is hampered, because so these three differential diagnoses will be there. Purish, the consistency of Purish. Hello.
Sir.
Am I
audible, sir?
Yes. The consistency of Purish is going to be essential, because that is the one, Srotas is the one which will give the Murtatva to the Purish. And as we know in Atisar, Ati Jalpan is one of the Hetu for Atisar to take place. And in cases of Brana, you will examine the Lasika. What is the nature of the Lasika that is there? to assess overall dushti of Udak Vaha Srotas in the patient. Next is Annava Srotas. When it comes to Annava Srotas, we will be assessing Pachak Pitta, we will be assessing Agni, we will be assessing Kledak Kapha, and we will be assessing overall the Amashay, which is Nabi Stantara Janto Amashay. What we are going to assess, especially when it comes to clinical examination, Nabi Stanantara Janto Amashay Tisprata, and hetus with respect to Pachak Pitta Dushti, hetus with respect to Agni Dushti, hetus that will affect Kledak Kapha. All these things are going to be an important assessment criteria when we are going to see Annava Srotas in the patient. So when it comes to Mulastan, in Annava Srotas, Amashay and Vamamcha Parshva, that is the left side of the trunk, this is going to be an important assessment criteria. And if I'm not mistaken, the TROPS area which is there, that is a very important area where you will find the change in NAD, especially in a respiratory disease. Yes, the TROPS area is a part of a respiratory this thing examination, but also in cases of the, if we consider the Nabistanantara Janto Amashayo iti Smrta, various diseases like Pliha Vruti, where Pliha is the Kittansha Vibhajan which is there, which is a part of Annava Srutas. All these things are coming. For example, when we are examining the Udar, if there is obliteration of the trough space, especially in Pliha Vruti and all, so that can be an important clinical assessment of, especially when it comes to Mulastan of Annava Srutas. What is the Dushti Hetus? Annava Srutas are affected due to overeating, untimely eating, Aithasya Bhojanat, and especially when there is Vaigunya of the digestive fire. So as we have already seen in the clinical anatomy, the how the digestive fire is there, what is the status of the Agni, that is going to be very, very essential when we are going to diagnose a patient with respect to Annava Srutas. So the status of the Agni is going to be an essential factor when Annava Srutas is considered. Dushti Lakshanas are Ananna Bhilasha, Arochakam, Avipako, Chhardi. These are the four Lakshanas that will indicate towards the Dushti of Annava Srutas. As we know that Aruchi is a important lakshan also in Rasava Srutas. So to differentiate between Rasa Dushti and to differentiate between Annava Srutas Dushti, the hetus are going to be an important aspect in that. So the hetus of Annava Srutas should be traced back in such patients, and the hetus of Rasava Srutas should be traced back to see which hetus are prevalent in that particular patient. So Aruchi is one lakshan that we will have to differentiate when we are doing Annava Srutas Dushti Lakshan Parikshan especially. So the differential diagnosis will be along with the Rasava Srutas specifically. Pariksha Bhav, Oshta Kapola Jiva, check for nutritional status, and the Agni Parikshan will be done by Agni Jaran Shaktya Parikshet. So the parikshan of Agni will be done on the basis of how Jaran Shakti is there, how much time he is taking to digest the food, what kind of food he digests. So the Agni Pariksha is going to be an essential component when it comes to Annava Srutas, and obviously the Udar Parikshan. Now Udar Parikshan, to be specific, I think so if students want to refer, the very systematic Udar Parikshan has been told by the Panchabhotik Chikitsa, the Datar Shastri, the clan of Datar Shastri, the Panchabhotik Chikitsa Paddhati. So that Udar Parikshan can be employed to do overall Parikshan. And apart from that, generally Udar Parikshan in terms of Ayurveda would be the presence of Adhaman or the presence of Vayu in the Udar. second important factor will be the presence of any gulma or any tumors with respect to that particular site. So these are the few things that we can do in terms of Udar Parikshan. A very elaborative topic we can discuss about this, but because of time constraints, I've just mentioned a Udar Parikshan should be done, especially in Andava Srutas. Now, coming to the Dhatuva Srutas, first is the Rasava Srutas. Twak and Loma Pariksha are the two Pariksha Bhav, as we have already seen. Twacha in Udakva Srutas was also there. There we are going to check the status of hydration status when twacha is concerned, and especially when rasa is concerned, we are going to check how well the twacha is formed, what is the overall complexion of the twacha that is there, especially in rasava srotas. Upadhatu, stanya and artav. So stanya, especially in females, especially in obstetric cases, if stanya is dushta or there is any problem with stanya, we have to trace back to see whether rasa dushti is there in that particular patient. Prenan karma is an important karma of rasa dhatu. So prenan karma, whether it is taking place in a proper manner or not, that we will see. Hriday is a important mulasthana of rasa dhatu, and hence when it comes to Hriday, there are various factors that are residing in the Hriday, and we can see that because Hriday is the mulasthana, we can tally it with the hetus of the rasava srotas dushti, and also the hetus of the pranava srotas dushti. For example, mana and oj are seated in Hriday, and hence we have to take into concern rasa dushti specifically in terms of unmad apasmar. Also, because the mana and oj are situated in hriday, and hriday is the mulasthana of rasava srutas, hriday is the mulasthana of pranava srutas, we can see that chinta, excessive stress, is going to do rasa dushti, as well as chinta is going to express itself as pranava srutas dushti, exaggerated, little bit of exaggerated shwas which is there. Second important factor when it comes to hriday, that it is a sira marma. So nadi, examination of the nadi is going to be an important factor to examine hriday. For example, in there are various dushtikar bhavas. For example, in jwara, rasa dushti is there. So in such cases, the nadi becomes druta. So the students, when they are examining nadi, apart from the dosha pradanya, we can see how is the rhythm and normal rhythm of the nadi. So in terms of jwara, where there is rasa dushti, there is druta nadi. In terms of even during stress, there is druta nadi that is seen. Shwasakasa is because of marma sampidya, and hriday is also one of the marma that is involved, especially in pranava srotas. If there if the doshas are marmashrit, then it is going to result in shwasakas. So that is also an important correlation that we see generally in the classics. It is an uttam pranayatan or chetana sthan. So chetana ka sthan is hriday, and hence in sannyas and murcha, uh, uh, it's hriday, the status of hriday is going to be important, and hence in sannyas and murcha, rasava srotas status is going to be important. Important in rasa vikshepan. So hriday is important in rasa vikshepan, and hence the vyana vayu which is there, that is going to play an important role when it comes to rasava srotas dushti. So any hetus of vyan vayu, we have to check for hetus of, or we have to check how the vyan vayu is functioning. Sadak pitta is an important thing that is seated in the hriday, and it is also placed in the kaphasthan. So all these physiological and clinical entities are going to affect the functioning of rasava srotas, and hence the assessment of all these factors, especially because hriday is the mulasthana of rasava srotas, is going to be crucial when we are going to clinically examine the patient. So As discussed earlier, that Hriday and Dashadhamani are the two things that are there. Hriday Parikshan, obviously, we will have to do by, in terms of Ayurveda, we will have to do by Prashna Pariksha specifically, by asking various questions with regards to Mana, Oja, etc. And Dashadhamani, obviously, the Nadi Pariksha is going to be an essential part when it comes to Dashadhamani Pariksha. What are the Srotas Dushti Hetu? So first, all the gunas of hetus are obviously kapha provoking in nature, except the Chintanam Chati Chintana, which is specifically towards indicating towards the mental aspect, the mana that resides in Hriday, the oja that resides in Hriday, and the sadhak pitta that resides in Hriday. So the Chintanam Chati Chintanath Hetu is indicating towards those anatomical and physiological factors that can be affected when such hetus are taken by the patient. And hence, Guru Shita Mati Snigdam, etc. hetus are going to do the proper Rasadushti or the proper Kafadushti that is there, which is eventually going to affect the Rasava Srutas. And Chintanam Chati Chintanath is specifically to towards all the other mental parts which are there in the Hriday. And hence, because they are residing in the Hriday, they have the capacity to create problems in the Mulastan and eventually create problems in the Srotas, which is there. So aversion towards food, anorexia, as we have said, aruchi is one important factor, and the DD of aruchi will be along with annava Srotas. So we will have to check which hetus are present in the patient. If a patient is coming with aruchi, we will have to check for annava Srotas Dushti Hetus, as well as we will have to check for rasava Srotas Dushti Hetu. We will have to do parikshan of their respective anatomical and clinical sites, and on that basis we will have to do a diagnosis as to which Srotas is involved in that. So altered sense of taste, inability to body ache, fever, blackouts, anemia, obstruction of channels. Calaibia is one important presentation of Rasadushti, and that is very important to consider, especially importancy today when there is rise in infertility cases. We should be able to diagnose that whether this calaibia is because of Rasadushti or whether this calaibia is because of Shukravah Srotas Dushti. And to differentiate between these two, the examination that we have seen earlier, the clinical sites of anatomical clinical sites and the physiological entities that are responsible for functioning of Rasava Srotas are going to be of immense importance when especially we are going to diagnose infertility. So the DD of calaibia should be Rasava Srotas Dushti, and whether it is Shukravah Srotas Dushti. Also, Medavah Srotas is also an important differential diagnosis entity when it comes to calaibia, because Ninditanam, Pramehanam, Purvarupani Yani cha, this is what has been told. And in Prameha, there is aversion towards sexual activity, because or sorry, in Meda Vritti, there is aversion of sexual activity, and hence the status of Meda is going to be an important aspect, especially when calaibia or impotency is concerned. So impotency differential wise, Rasava Srotas, Medava Srotas, and Shukravah Srotas, these three are going to be then important differential diagnosis, and the approach to them is going to be their respective clinical, anatomical, and physiological sites and contents, and their respective hetus. This will help us to diagnose between calaibia. So this is a very important or a very picturesque presentation of how Hriday can be a Mulastan of both Rasava as well as Pranava. So in cases of currently, for students to understand, In left heart failure, we can see that there is decreased output and there is pulmonary congestion, and all the symptoms of pranava srotas dushti can be seen, especially in left heart failure, like orthopnea, cough with frotty sputum, etc., dyspnea, etc. Signs of cyanosis or hypoxia. And when it comes to right heart failure, the symptoms of right heart failure, all the symptoms of rasava srotas dushti are seen. Example, because right heart failure leads to congestion of the peripheral tissues, and basically it is going to show GI distress, anorexia, weight loss, all these krushangata, aruchi.
वर्गात पोरं एवढे असे टोचत नाही असं इथे तुम्ही फ्लो तोडता.
काय करतात ते आपण तिकडे घेऊन चाललो त्यांना.
Yes, sir.
Yes.
You can continue.
Okay, sorry. So Hriday, how Hriday is said to be the Moolasthana of both the Srotasas, Pranava as well as Rasava. This particular picture is will give a very good idea as to how it can be correlated. So left heart failure, currently जो left heart failure है, it will show all signs of pranava srotas dushti, and the right heart failure will show all signs of rasava srotas dushti. Raktava srotas. Now, specifically, the organs that have been placed in front of you, example, karna, akshi, mukha, jiva, nasa, oshta, pani, pada, tala, nakha, lalata, mehana, etc. All these are the references of Sarata Parikshan by Charan. And hence, if Sarata is expressed at these particular sites, then obviously Vikruti can be, if there is Vikruti of these particular sites, we can think about the respective Dhatu Vaha Srotas. So ears, eyes, face, tongue, nose, lips, palm, sole of foot, nails, forehead, and the penis. If in any dushti all these parts are involved, then it is, for a systematic review, we can make sure that we assess the patency of Raktava Srotas. Especially, let's take a small example of, Hasta Padatala Daha. Okay, so Hasta Padatala Daha, we get this in diabetes, or normally also in very much Pitta Prakruti person, they will have Hasta Padatala Daha. So Hasta Padatala, as we can see, Pani Padatala is a Sarata. It is explained in Sarata of Rakta Dhatu, and hence during examination the students should make a point that they examine or they consider if the presentation is on Hasta Padatala, if the presentation is on the pinna of the ear, if the presentation, any disease is presented in the eyes, over the face, over the tongue, we should make sure that we examine the Raktava Srotas properly. And this is what clinically is going to be important, apart from just assessing hetu and just assessing lakshanas. These anatomical sites should be taken into consideration, and if the logic behind this is just that if Sarata is expressed at this particular site, then if Rakta Dhatu is exceptionally deranged, then obviously it is going to present at these particular sites. So this will not just give a systematic view as to what is going on in the body, rather it is going to cement your diagnosis when it comes to diagnosis as a Rakta Dushti just on the basis of Lakshanas or on the basis of Hetu. Any presentation at this particular site is going to certainly cement your diagnosis of Raktava Srotas Dushti. So Upadhatu, Sira and Kandara is the Upadhatu of this thing. Jivan Karma is the karma of Rakta Dhatu, and Yakrut Pliha, the status of Yakrut Pliha is going to be very important. So when we are doing Raktava Srotas Dushti Parikshan, the feel over Yakrut and the feel over Pliha is going to directly indicate towards Dushti of Raktava Srotas Mulasta. And hence, it is going to further cement your diagnosis of Raktava Srotas Dushti, not just on the basis of Hetu and Lakshanas, rather its Mulastan is also hampered. So basically, in cases clinically also very much it is seen that Yakrut Oshnya and Pliha Oshnya, this is very much used, especially by Tatar Shastri Panchabhautik Paddhati. The Oshnya over Yakrut and Pliha is going to give very good clinical involvement of Raktava Srotas. So Shonita Mahanam Srotasam Yakrun Mulam Plihacha. As we have discussed earlier, the Mulastan is going to play a very important role in examination of their respective Srotas, and hence Mulastan examination is important. As discussed earlier, when we are examining the Yakrut and Pliha, we are looking for any Vritti, or we are looking for Stanik Oshnya that is going to indicate towards Rakta Dushti in the patient. So what are the hetus? Hetus are Vidahi Anna Sevan, any drinks or food which will cause burning sensation in the body. Those which eat or drink Snigdha and Ushna, this thing. Snigdha and Ushna substances, a lot of Drava, especially of Snigdha and Ushna Gund, and obviously Bhajatam Cha Atapanalo. Sun or fire, exposing oneself towards sun and fire is going to do dushti of Raktava Srotas. And the general public, especially which are having Raktava Srotas dushti, are nobody but these salesmen, the traffic person who is standing in the heat which is there. These are a specific group of individuals which is certainly show such kind of presentation. And if you look at their overall structure, you will see a traffic personnel, his eyes will be red. Basically, there will be lot of overall, overall twacha, or his face will be of a very darker complexion most of the time, especially the people who come to clinic, or the amount of people they have seen till now. They are specifically subjected to a lot of Yakrut related diseases because of their obviously ahar vihar that is hampered. And all such kind of presentation, especially at the anatomical sites of Rakta Dhatu, are very much evident in such cases. And hence, along with Hetu, the assessment of the anatomical sites are going to be very crucial when we are going to cement our diagnosis as Raktava Srotas Dushti. What are the Lakshanas? The Lakshanas are all skin related disorders, including Kushta. Visarpa is an important indicator of Rakta Dushti. Pidaka, furuncles, Rakta Pitta, menorrhagia, inflammation of the anus, penis, oral cavity, splenic disorders, pliha vritti, because pliha being the mulastan. Gulma, vidradi is an important this thing presentation, especially in Rakta Dushti. Nilika, Kamala, Vyanga, Piplavas, Tilakalak. So all these Shudra Rog which are there, they are going to manifest in terms, and they are going to tell us that Rakta Dushti is persistent in this particular individual. So overall, the Dushti Lakshanas, if are present, are certainly going to tell us that Rakta Dushti is there. We are going to go a step behind, and we are going to check for Hetus. Then we are going to go a step behind, and we will check for the respective anatomical and physiological factors of the Rakta Dhatu, if they are involved and not. And then finally, we can cement our diagnosis as Raktava Srotas Dushti. Next is the Mausava Srotas. So when it comes to anatomical sites for the assessment of Mausava Srotas, obviously the temples, forehead, atlanto-occipital joint, eyes, cheek, lower jaw, neck, shoulder, axilla, chest, and the joints of the limbs. So Lepan is the karma, and hence when we are assessing at this particular site, we are looking at Lepan karma of Mausa Dhatu at these particular points specifically. And if any other vyadhi is taking place at these particular points, we are going to take into consideration Mausa Srotas specifically. So in cases of shoulder, axilla, chest, joints of the limbs specifically, where Lepan karma is hampered, or if these sites are involved, apart from, for example, joints of the limbs, अगर हम consider करेंगे, we will think about Asti Srotas, we will think about Majja Srotas, and also we will think about the involvement of Mausa Srotas, especially in terms of the Lepan karma of the Mausa. The Vasa and Twak, these are the Upadhatu. So उपधातु का परीक्षण भी इसमें हम कर सकते हैं clinically to assess what is the status of the Mausa Srotas. Snayu and Twak, these are the two Mulastan, and recurrent Snayu related problems. We will have to check for Dushti of Mausa Srotas, and hence because any ligamental problem, we will consider Mausa Srotas as one of the examining factor, and we will examine the status of Mausa Lepan karma over the sites that we have previously seen, to make sure the Lepan karma is properly taking place in this or not. And we will check for the hetus of Mausa Srotas Dushti. This entirely will going to help us to make a diagnosis that Mausa Srotas is involved in the patient. So what are the hetus? In hetus, Abhishyandini Bhojani, Stulani cha Guruni cha, and Mausavahini Dushyanti Bhuktam cha Sopatam Diva. So all these hetus are going to increase the chances of doshas creating dushti in Mausa Srotas specifically, and hence in cases of any presentation over the anatomical sites, our job is to make sure that we tally it with the hetus of Mausa Srotas Dushti, if it is evident or not, along with the presentation that is there. So Abhishyandini Bhojani, Stula Anna, Guru Anna, and obviously Bhuktam cha Swapatam Diva. So Diva swap, especially after eating food, is one important hetu. Diva swap here meaning after sunrise, whenever if he is sleeping, it is going to be counted as Diva swap, and that is going to be an important hetu, especially after if he eats and does Diva swap, it is going to be a specific hetu to Mausa Srotas Dushti. What are the presentations? As we can see, the hetus are all very guru stula type of hetus that have been told by the acharyas, and hence the presentation is also going to be Adhimausa, Arapuda, Kila, Galashaluka, Shundika, Putimausa, Alaji, Ganda, Gandamala, and Upajivika. So all things that is having increase in their normal size, or increase the guna of the hetus are going to present in such a way that the size of the particular presentation site is going to increase, which is a typical feature of Mausa Dushti. For example, in Mausa Vrut Vatekse, Kathina Stula Shof, this is sort of a presentation that you get. So the guna of the dhatu is going to be shown very easily in such cases. So in cases of Galashaluk uveitis or tonsillitis, recurrent tonsillitis, we have to consider the Mausa Srotas, whether its patency is there or not. Meda Srotas, what are the factors that we are going to consider? First is complexion, voice, eyes, hairs, body hairs, nails, teeth, lips, urine, feces, and obviously how is the presentation of these particular things, especially. So complexion, voice, eyes, hair, especially body hair, All these things we can see that complexion for do differential diagnosis, there is Rasava Srotas is also there for differential diagnosis. Voice, we will see Majja Srotas will be there for differential diagnosis. Eyes, till now we have seen Rakta Srotas, Mausa Srotas, and now Meda Srotas. And further in Shukra Srotas also eyes are explained. So any pathology at this particular site, we are going to take into consideration all these srotas. So when it comes to eyes, we are going to think about Meda Dushti, we are going to think about Shukra Dushti, we are going to think about Rakta Dushti, we are going to think about Mausa Dushti. And this is going to give us a very good clinical insight as to how our treatment protocol should go ahead, which dushyas are involved, and how our treatment protocols are going to go ahead. Nails, teeth, again astiva srotas is coming into picture when we say nails and teeth, but we have to also consider what is the status of med, especially, and what is the Paikshan criteria for nails, teeth, lips, etc. There should be sneha yukta. So if there is dryness of nails, teeth, etc., it is not just the asti dhatu, as in vata vriddhi in asti dhatu, that we are going to assess. Rather, we are going to assess the snehan karma of meda dhatu. So as we know, meda ka karma hai sneha. So all these sites pe agar sneha ka if there is less amount of sneha, or the sneha is not being expressed properly at these particular sites, then not just asti dhatu that we are going to assess, क्योंकि वात के वृक्ष गुण बढ़ने की वजह से यह स्नेह क्षय हुआ रहेगा, but also we are going to assess the snehan karma of meda dhatu. And generally we see that medasvi people, they suffer from a lot of bone related this thing bone related conditions or joint related conditions. Weight, increase in weight or weight bearing joints pay excessive weight is, yes, that is one of the functions. But when meda dushti takes place, the normal karma of the meda dhatu, that is snehan, that is hampered, and hence the presentation is seen at that particular site. Why? Because meda is present in asti. Meda Puran in Asti converts into Majja, and also Meda is present in Sandhis, that is the Rakta Meda. So the Snehan Karma which is there at Sandhis, the Snehan Karma that is there at the Stan of Asti, it is primarily dependent on the status of Meda. And hence, in terms of Sandhi Vyadis, or in terms of presentations over Asti related factors, for example, nails, teeth, hairs, the status of Meda Dhatu is going to play a very, very critical role. So all these factors are important. Another thing that is important is the Mulastan. Vrukka and Vapavahan are the two Mulastans that have been told by the Acharyas. So Vrukka is it is Udarastha Medo Goloku. So this is nothing but it's the overall its presentation looks like that of a kidney. And if we see in kidney related disorders or chronic kidney disease, there is excess amount of sneha that takes place. And you can see the patient, the way there is excessive vrukshata that develops in the patient. So in cases of chronic kidney disease, it is not just the mutra srotas that we will consider. Rather, it is going to be also the meda srotas, because snehan, the karma which is there, that is completely being hampered overall in the patient. And hence in CKD sort of conditions, the status of meda dhatu is going to be very important. So Vrukka and Vapavahan in that sense is going to be very important. And any disease related to this particular sthana, we are going to assess the how is the meda dhatu in the patient. What are the hetus? Hetus specifically, there is lack of physical exercise, Then there is Diva swap. That is the proper Diva swap. In Meda Mausava Srotas it is Bhuktam cha Sopatam Deva, but here it is Diva swap, which is the proper definition, as in Surya after the sun arises, if the patient is sleeping, it is considered as a Diva swap. That is quite evident today. And Medyanam chati bhakshanat, excessive intake of fatty food, and obviously Varunyasya ati sevanat. So excessive alcoholic drinks is going to be the primary hetu for Medava Srotas Dushti. What are the Srotas Dushti Lakshanas? Any symptoms, all symptoms with relation to Purvarup of Prameha. And we know that in that there is Jatila Keshaha, etc. All these Purvarup have been told in Prameha. So we know what is the correlation now, as in the Snehan Karma which is there, that is being hampered, and that is why it is expressed in that particular site. मतलब सारते के जो मेद सारता का जो sites बताए हुए हैं, वहीं पे ही we can see the presentation of meda dushti being expressed, and hence the anatomical sites and the physiological entities of their respective dhatus are going to be very critical when we are going to do Srotas pariksha. Astiva Srotas, what are the sites where we will see for Asti Dushti is obviously the heel, ankle, knees, forearm, collarbone, chin, head, small joints of the hands and feet, bones, nails, and teeth. All these places we are going to, these are the places where Asti Srotas is expressed in a very prominent way, and hence these are the sites that the student should make a habit. This should be the normal temperament of the student to check these sites when we are assessing the Astivah Srotas. One important this thing is Purish Dhara Kala and Asti Dhara Kala are similar, and I will give an example in Purishva Srotas as to how we can interpret this. Karma is Dharan, so or Patan related conditions. For example, in Kushta, the teeth, nail, and all fall from the patient's body. So Astiva Srotas is getting involved. This is what it is indicative of. And any presentation, any Anukta Vyadhi presentation over all these places, anatomical sites, are going to indicate towards the presence of Astiva Srotas Dushti. For example, let's see Parshni Shul. So Parshni Shul can be through the X-ray also we can see that there is the calcaneal spur, that is Asti Vriddhi, that is taking place. So Astiva Srotas is going to present, Dushti of Astiva Srotas is going to present at these particular sites, and hence their assessment is going to be an important factor. So check quality of Kesha, Nakha, and Danta. As we have seen, Kesha, Nakha, Danta are also a part of Medava Srutas, specific to the Sneha of the Kesha, Nakha, Danta. It is going to be also important in Astiva Srotas, but in what sense? It is important in the terms of Sthula and Sthira Kesha, Nakha, Danta. So stula and sthirata and stulata of the Kesha, Nakha, Danta, if it is hampered, then it is going to be Astiva Srotas Dushti. For example, if there is hair fall, but the anactousness, the snigdhata of the Kesh is maintained, then it is not the Meda Dhatu that is involved. We have to check, we have to consider the Asti Dhatu. And if there is roughness of the Kesha that is there in the patient, then we will be primarily focusing on Meda Srotas or Meda Dushti. We will check the whether Meda Srotas is Dushit or not. So this is how we will go ahead with it. So the Moolastan is obviously Meda and Jagana, and all the buttocks, or maybe the pelvic girdle, we can say, that is the Moolastan of Asti. and the status of Meda is going to be an important factor when it comes to Astiva Srotas Dushti, and hence why, because Ashraya Ashray Sambandha is there between Vayu and Asti, and if एक वृद्धि हुआ है तो दूसरे का क्षय हो जाएगा, तो to keep Vayu into check, to keep the check over Vayu, the Meda is important, the Snehan karma of Meda is important, and hence in Astiva Srotas the how is Meda Dhatu, that is going to be an important factor of assessment. What are the Srotas Dushti Hetus? Due to excessive physical exercise, excessive jerks to the body, excessive trauma, and constant use of Vata aggravating material. All these things are not going to do, but nothing but they are going to do the Sneha Kshay in the this thing. Excessive jerks are, or excessive trauma is going to hamper the Meda Dhatu that is there in the bones. The Rukshata is going to increase. The Vata Vriddhi, which is taking place because of excessive Vatal Sevan, is going to increase the Ruksha Guna, which in turn, because of Ashraya Shri Sambandha, because Vata is Vriddhi, there is Astikshay, and apart from that, the Ruksha Guna is going to affect the Meda also in the patients. So what are the Tushti Lakshanas? There is hypertrophy of bones and teeth, splinting or severe pain in teeth and bone, discoloration, abnormal discoloration of the bone or discoloration of the teeth, discoloration of the nails, abnormality in body hair, nail and beard. These are the disease that is caused because of Asti Dushti. So Smashru dosh, which is there. It is it is seen in Astivah Srotas Dushti also, and it will be seen in Shukravah Srotas Dushti also, because Smashru Utpatti is an important part of Shukravah Srotas. So when there is involvement of Smashru, we are going to do differential between Astivah Srotas Dushti and differential between Shukrava Srotas Dushti specifically. So now Majja Srotas. So what are the things that we will consider when Majja is involved? So Puran is the karma of Majja, and the persons will have primarily in Sarata. This is what Sarata they have explained. In Sarata, the voice is explained, the complexion is explained, and joints, the overall shape of the joints has been given into consideration. So in cases of chronic osteoarthritis, etc., as we can see, the normal anatomy of the joint is totally deranged when osteoarthritis is going on for a longer period of time. So instead of prominent, long and rounded, as in very nice anatomically well placed joints, there is exactly distorted appearance of the joint. And when there is such appearance of the joint, it is indicating that Majja is involved in the patient. So that is going to be an important factor as to what is the normal anatomical structure of the joint that is there. And if that normal structure is distorted, we can say that Majja Dhatu is involved. Why? Because in Majja Sar, the joint is very well and anatomically very well placed in the patient. Next is Pittadhara Kala and Majjadhara Kala are similar. So this might be an important factor to explain why Viruddhanam cha Sevanat, the Hetu which is there of Majja Srotas, that is that is going to be a very important Hetu for Majja Dushti, because Pittadhara Kala and Majjadhara Kala are similar when it comes to the Kala. What are the Mulastan? Asti and Sandhi are the Mulastan. So any presentations over the Asti, any presentations over the Sandhis are going to indicate the involvement of Majja Srotas or Majja Dushti. What are the Hetus? Utpeshat, Atyabhishantat, Abhigatat, Prapidanat. मज्जावाहिनी दुष्यन्ति विरुद्धानां च सेवनात्. So crushing of bones, excessive discharge or abhishanti causing foods that are there, trauma, compression, and repeated consumption of viruddha ahar. So viruddha ahar over here can affect majjavah srotas because pittadhara kala and majjadhara kala are similar. So that is how the viruddha ahar sevan will affect majjavah srotas or will help into majjadushti. What are the presentations over parva sandhi? Giddiness, bhrama, murcha, blackouts, tamadarshan, arunsha stula mulanam, deep rooted abscesses in the joints are caused because of visheshan of vajradhatu. So the normal stature of the joint, apart from this normal stature being hampered in majjadushti of the joint, there is ruk, especially in parvasandhi. There is brahma, there is murcha, and tama darshan is there. The patient experiences tama darshan. Arunsha stula mulanam, there is abscesses that are formed in the joint, and this will indicate towards the dushti of majja in the patient. When it comes to Shukravah Srotas, the Sarata, if we see the Sarata, the person is very gentle, charming. He has a very gentle look. He has beautiful eyes. So Shukra will express itself in eyes if it is in a very Sara form. He will be Praharsha Bahul, exhilarated towards the opposite sex primarily. The teeth, there is a mention of teeth, how the teeth should be, and also the complexion, voice of the individual. So whenever we are examining the Shukravah Srotas, it is not just the hetus with relation to its normal sexual life that are going to give us clues, but also the nature of the individual. Especially we see infertility patients, how they behave with the doctor and with among themselves also. That is very good indicative, this thing. The eyes, especially. So eyes, if you want to examine eyes, there is Mamsa Dhatu, there is Rakta Dhatu, there is Shukra Dhatu that is there, that is involved. And the differential amongst them is going to give us idea as to which dhatu is creating such kind of a lakshan. The teeth, jaise we have seen earlier, the Meda dhatu, the Asti dhatu, and now also the Shukra dhatu. So when we are examining the teeth or when we are examining the Srotas, Suprava Srotas, we are going to take into consideration this point also. Overall complexion of the person, how is the voice, and speak. So infertility patients, it is important to see whether the sphic of the individual is in praman. So praman shari is going to play an important role, especially when all these sites examination is concerned. Not just the vikruti, but the praman of that particular organ or that particular site is also going to give us very good examination details. What are the other factors? So Vyana Vayu, Apan Vayu, Vrushan is made up of Mamsa, Rakta, Kapha, and Med. So any Vrushan related disease, we have to check the status of Mamsa, Rakta, Kapha, and Med, because it is made up of the Prasad bhag of all these things. So Vrushan related disease, we will check the patency of Mamsa, Rakta, Kapha, and Med. Apan and Vyan, these are two very important. Why? Because Acharya Shushruta said, Shukra dosa pramehastu vyana apana prakopaja. And a very good example to tell or to explain this, how Vyan and Apan are going to play an important role, is the example of a lizard shedding its tail. So lizard shedding its tail, after the lizard sheds its tail, we know that the tail keeps on wobbling, and the same case can be with Shukra dhatu. The chavan of Shukra is in the control of Apan Vayu, and whereas the delivery of Shukra is in the control of Vyana Vayu. So the Apan will initiate the chavan, that is the delivery into the vagina, especially in the male, and from the vagina the motility of the sperm is dependent on the Vyana Vayu. So in Shukravaha Srotas Dushti, we have to see whether Apan Prokop is there in the individual or whether Vyana Prokop is there in the individual. So we can generally, we can hypothesize this thing. We will have to research over this, that if Vyana Dushti is there any changes in the motility of the sperm? Because Shukra is not sperm basically, but for to put it into normal terms, we can try to do this. That whether Vyana Hetus are there predominant, or Vyana Dushti is there, especially in less motile or non-motile sperms. So the initiation of Shukra Chavan is in the purview of Apan Vayu, and the delivery of Shukra is dependent on the Vyan Vayu of the male especially. So this is how Vyana Apana Prakopaja, when Shushrutacharya says Shukra dosha pramehastu Vyana Apana Prakopaja, this can be a very good example. And the example to it is the shedding of the lizard's tail. So once the shedding aspect is under the Apan control of the Apan Vayu, and then the wiggling of the tail, which is there even after it is gone away from the body, is in purview of the Vyana Vayu, because Vyana Vayu is Mahajav. It has immense force, and it has immense speed. So it has so much speed that it will keep the, once it initiates that particular moment, it will keep on wobbling. So this is how we can assess. Maybe we will have to research over this particular aspect. Smashuru Utpatti, as we have seen in Smashuru Astiva Srotas, Smashuru Dosh is explained. So any individual or adolescent, if he is coming with Smashuru Dosh, we have to assess whether it is because of Asti Dushti or whether it is because of Shukra Dushti. So this is how the differential will take place. So Vrushan and Shef, these are the two Mulastan when it comes to Shukrava Srotas. And as we know, any Vrushan related disorders, we are going to consider Mausa Rakta Kapha Meda Prasad, just in case if you want to treat in that sense. And we will approach that particular thing in by assessing the patency of Mausa Rakta Kapha Meda, because the Prasad bhag of all these things are going to contribute to Vrushan. And Shef obviously is the shaft. So the examination of the shaft is going to be essential. So examination of shaft or the examination of the penis will be there in two specifically two srotasas. First is the Raktavaha Srotas, and second is the Shukravaha Srotas. Tushti Hetu is obviously it is very related to the Mulastan, especially the Shef. So sexual activity at improper hours or through non vaginal tract, suppression of discharge of semen, excessive coitus, and Shastra Kshara Agni Karma Vihi. All these Shastra Kshara and Agni Karma are going to hamper the this thing, the overall status of the Shukra. Also, one point I forgot to add is the Shukra Dharakala. So Shukra Dharakala is said to be Sarva Sharira Vyapi. And generally what is happening right now is that after coitus, the vidhi, post coitus vidhi, which has been told, example, for example, taking milk, taking rest, taking a cold shower, all these things are not being followed, and this happens very frequently in IT individuals. So these hetus are going to contribute to Shukra Dushti, because Sarva Sharira Vyapi Shukra Dhara Kala, and especially if Sarva Sharira related, for example, after coitus, hot snan in a hot water bath, may affect the Shukradhara Kala, eventually affecting the Shukravah Srotas. Not going to sleep post coitus is maybe going to affect the uh, Shukravah Srotas, because Shukradhara Kala is involved and it is Sarva Sharir Vyapi. So Sarva Sharir related hetus are specifically seen, and this is very much evident today in the IT individual, the group of IT people. What are the Dushti Lakshanas? The persons become sexually important, suffers aharsha, and the because Shukrat Garbha Prajayate, Dushti of Shukra is going to travel over the generations, and hence the this thing, the progeny which is there, it is going to be sick, it is going to be short lived, and uh, the assessment of a particular child, in fact, especially any congenital abnormality in a child, should start with his parents, because Shukravah Srotas is involved, and hence in Shukra Dushti we can see that the Lakshanas are traveling through generations. So that is going to be an important aspect, especially when we are doing a parikshan of Shukravah Srotas. Mutravah, clinical anatomy and physiology. Apan Vayu, status of Klet, as we have seen earlier, status of Udak is going to be important. Pakvashay is going to be important. How is the normal Sarakitta Vibhajan in the patient? Basti is, we should remember that Basti is one of the three marma. And if we see the Mulastan, it is Basti Bulam Vangshanavsha. So Basti related presentation or Mutra related presentation, we have to do Marma assessment. So in Pranava Srotas, in Rasava Srotas, there is the involvement of Hriday as a Marma, and in Mutrava Srotas, there is the involvement of the Basti as a Marma. So Marma Stanagata Vyadi we will have to take into consideration. Next is Apan Vayu, obviously Mutra, the passing over of urine is in purview of Apan Vayu. Similarly, Saman Vayu is going to play an important role because it will do the Sarakitta Vibhajan in such cases. So many Vaidyas, Vruddha Vaidyas, etc., they in Mutra related disorders, they have done Grahani Dushti Chikitsa, taking into consideration Saman Vayu as one important factor for Sarakitta Vibhajan. The status of Pakvashay is going to be an important aspect. The status of Kled is going to be very important. That is the status of Udakva Srotas. So Udak is going to basically involve affect the Mutra Pravrutti. And finally, for examination purpose, Mutra, proper physical examination of the Mutra can be done for Rasa, Gandha, Varna, amount, etc. So the Mutra Parikshan by Yoga Ratnakar, etc. can be part of this particular examination. As we have seen, Bastini Mulam Vangshanam Cha, so pelvic region, including the kidneys and the urinary bladder, this everything is going to be an important part of the Mutra Srotas. But we should not forget that the Utpatti of Mutra is from Pakvashay, and hence the assessment of Pakvashay is going to be an important aspect of it. What are the Lakshana? What are the Hetus? Consumption of water, food during coitus or coitus, especially when the urge of micturition is present. So consumption of water and food and coitus, especially when the urge of micturition is present. Suppression of vega growth is a very important very important aspect. And the most eye-opening entity in terms of Hetu is Shinasya Kshatasya. So Shin and Shata individuals, they are very prone to Mutra Srotas related disorders. So we can see that Vyadik Shin Vyakti, finally they go into this multi-organ failure sort of conditions. So this can be one of the reasons for that. What are the Lakshanas? excessive excretion, excessive obstruction or suppression of urine, vitiated, diminished or frequent thick urine with pain. So all symptoms related to pravrutti are seen in Mutrava Dushti Lakshanas. But apart from that, we will make sure we assess the status of Udaka. We will make sure we assess the status of Apan Vayu. We make sure that the basti as a marma, there is no marmaghat causing hetus. We will make sure that the pakvasha is properly maintained, and in that sense we will check whether urine, how is the urine of the individual. Purishva Srotas Pakvasha, especially in Purishva Srotas, Pakvasha is also important, but here the peristalsis are going to be an important aspect. So how is the normal gati of the Apan? So when it comes to Purishva and assessment of Pakvasha, we are going to assess about the peristalsis in the patient. Next is obviously the Purish, that is Gandha, Varna, Sama, Niram, etc. Assessment. So whether it is Durgandhi or not, what is the Varna of the Purish? These are various things that have already been explained in Samhitas. I'm just ticking them one by one because we are short on time. Agni and Grahani status is going to be important. Apan Vayu is the hetus of Apan Vayu, especially in Mutra Srotas and Purish Srotas, and also in Shukra Srotas, are going to play an important role. So in Vagbhat Nidanstan Vatarakta, there are hetus for each Vayu, there are hetus. So we can use that to assess if Apandushti is there or not. Guda, if there is any physical obstruction at the Guda, and also the presence of Guda as a murmur over there. So all colorectal cancer individuals, we can assess the Guda, what is the status of the Guda, and we can check whether the murmur is involved or not, the Guda murmur is involved or not. If it is involved, then obviously the prognosis is going to be a bit difficult for us. We know that Asthidhara Kala and Purishdhara Kala are similar, and I'm going to talk about this in the upcoming slides. Let's see what are the Mulastan. The Mulasthana are Pakvasha, and the Mulastan is Stula Guda, the anorectal region. So while examining the Purishva Srotas, we are going to check for peristalsis in the patient. How is the peristalsis? So to assess the Purishva Srotas patency, and we are going to check, we are going to do the Guda Parikshan. So whether as a murmur, how is the Guda? Here also the Anguli, Praman, etc. we can use Praman Shari, especially we can use. What are the hetus? Specific hetus like suppression of urges of defecation, overeating, eating during indigestion, especially in persons with poor digestion and those who are emaciated. So overeating and eating during indigestion, these are very important hetus. And the second criteria in the patients with Durbal Agni and Krushasya. So I would like to point out to all those individuals who go to the gym, especially who are Krusha and who take excessive intake of excessive Guru Anna, Atimatra Anna, and taking Anna at very regular intervals. And eventually you understand, or in the clinic also many such patients come with complaints of Keshapatam. So Purishdhara Kala and Asthidhara Kala in such cases can be relatable. Okay, the hetus which are there, these are all Purisha Vaha Srotas Dushti Kar hetus. In those select individuals, if we check their Purish or we do Srotas Parikshan, we will understand that Purish Vaha Srotas Dushti is very much evident. And such cases will certainly, or after going to gym, the patient starts complaining of hair loss, etc. So we have to just assess whether the Purish, this hair loss is because of Ati Vyayam, etc. hetus, or whether there is involvement of Purish Vaha Srotas, because Purish Dhara Kala and Asthi Dhara Kala are related. So this is how the relation can form, especially in such a class of people who indulge in a lot of overeating, a lot of indigestion, and their criteria is that they should be Durbalagni and Krusha. So in such cases, we would rather focus on Purishva Srotas, this thing. We will tell them to stop their excessive eating, etc. And instead of focusing on Asti Vaha Srotas, we will do Pachan, Ama Pachan, etc. Chikitsa in such cases if the Purishva Srotas is involved. So this is a very good sort of a Hetu Sangraha that you get, and it is very much predominantly seen today in the current era, especially in individuals who go to the gym and who are thin and Durbalagni. They show presentations of Astiva Srotas Dushti, basically. So this is a matter of research, however. We will have to see whether this is prevalent in today's era or not. What are the symptoms? Difficulty in evacuating balls, scanty stools, passage with sound and pain, loose motions, and irritable or irregular bowel. So such cases, the sample that I had described previously of gym going individuals, they show such kind of a presentation, especially their stool is not very well formed. There is a lot of durgandha. There is a need of pravahan. Okay, and they complain that after starting from they take a lot of protein intake. So these are all satisfying the criterias of Purishva Srotas Dushti Hetu, Ajirnashan, Atyashan, etc. So this can be one research topic. So the last Srotas is Vedava Srotas. Check the status of Udak, absolutely. Check the status of water intake. Look for Loma Kupa, because Loma Kupa are going to be essential because they are the Mulastan of Swedava Srotas. Check the assess the Meta Dhatu because it is a Mala of Meda. Clay the Vidruti is the karma, so check Sweda Pravartan. Ask about Gandha, Varna, staining of the clothes. Check Pitta Dosh because it is Ashraya Shri Bhavatam to Sweda Raktayoho. Vyana Vayu and Saman Vayu because Sarakitta Vibhajan, and there is a very good relation of Saman Vayu and Sweda Pravartan specifically. Saman Vayu should be checked for. The Hetus of Saman Vayu should be checked for. Hetus of Vyana Vayu should be checked for. And yes, Twacha. So in that sense, Twacha, because first the Loma Kupa are situated there, and the status of Udak is going to be given, or the status of overall water content in the body is going to be given by the hydration status of the Twacha. So this is how overall Sweda Srotas Parikshan should be done. What are the Mulastan? It is the Ved and the Loma Kupa that we have to check. So Meda Dhatu is going to play an essential role in Medavaha Srotas. It is going to play an essential role in Astivah Srotas, and it is going to play an essential role in Swedavaha Srotas also. So what are the hetus? Excessive physical exercise, excessive heat, inappropriate use of hot and cold substances. Shitosna Krama Sevanat, especially such kind of hetus, we can say one prominent hetu is people drinking a lot of tea. So before drinking tea, they go to the cooler and they drink one glass of cold water, and on top of that they will drink tea. So Shitoshna Krama Sevanat is can be we can say that that is one of the hetus that we find normally. Krodha Shoka Bhayastata is specific to Sweda Dushti especially, and overall this conundrum will result in the presentation of loss of perspiration, excessive perspiration. There is overall parushya, coarseness that is there, or atis lakshnata, excessive smoothness over the twacha. Because as we have seen, udakam, kledayati, kleda vitruti, all these things which are there, these are physiological functions of the swed. This is going to manifest in such sense, and Paridaha, Loma Harsha, horripilation, because Loma is the Srotas Mulastan. Thank you very much. I think so. This is very short way of explaining how we can systematically approach Srotas. And due to our time constraints, I am sorry I just over exceeded the time. But thank you, Academy of Rognidan. I would like to thank Kar sir and Ganesh sir, also Godatwar sir, for giving me a chance to present today. Atul sir, thank you very much for giving me this opportunity. I would like to thank my HOD and my colleagues from Bharati Vidyapeeth, my HOD Abhinandan Mukesh sir, who motivated me all the time to take up this presentation, and also my gurus, especially I would like to dedicate this presentation to my guru, late Vaidya Anil Panse sir, the person who created this temperament in me of thinking in such a way, with the Upendra Dikshit sir, Dr. Santosh Bhor, Dr. Nilesh Korde, and Dr. Chandra Kumar Deshmukh. Thank you all.
Thank you.
Yes.
Thank you very much, sir. Actually, it is very difficult to cover all the Srotas in very small time. So don't feel sorry to extend the time limit. It is actually happening every time when we go Srotas. And I congratulate Dr. Advait sir, who has compiled all the information and current knowledge about Srotas. I would like to ask the audience if they have any questions, or otherwise we will wind up this today's session. So, okay. Thank you, sir.
Thank you very much. Yeah.
Thank you. Thank you very much, sir. We will next time again. We'll take a one. We would like to have one Srotas examination of one Srotas, or we will take 13 lecture series.
No, in that sense, I just read the overall this thing. This lecture series is for the UG graduates. So
Yes, sir, yes.
overall, in one sense, at least the approach towards how to do Srotas prediction. That is why all the Srotas were taken and covered in a very short way. Just to say
Yes,
that.
sir. No issues, sir. Actually, I am finding us another technical person who can be join with me.
Achha.
And we will definitely have a Srotas examination for UG
Yes,
students.
certainly.
Actually, the aim of this lecture series is to make our UG students available knowledge and current thinking, thought process क्या चल रहा है अभी.
Yes, yes.
Because they always, I would not mention any name of any textbook. Just they study for only passing the exam.
Yes, yes.
Our motto is to just show them the path that you can think like this also.
Yes, yes.
Yes, sir.
Yes. Thank you very much. Thank you.
Yes, sir. Thank you. Thank you very much.
Bye.
Bye.
Yeah.